Welcome to Public Health Matters, where we talk about things that matter to the public. I'm Bobby Bagley, Chief Public Health Official for the City of Nashua's Division of Public Health and Community Services and the Director. And I'm here this afternoon with Seana Bouchard, who is and you're going to have to help me with this, the Division Pharmacy Manager.
Perfect.
For Shaw's.
Perfect.
And this is a new position for you. So we're going to talk about the new initiative that Shaw's has for investing more in the community and the services that are being provided, as well as, of course, the things that we are already very familiar with food, of course. We'll talk about that.
That's right.
But we'll also talk about some of the new initiatives. Great. So tell us a little bit about yourself, Seana, and the new position that you have. And welcome to New Hampshire.
Yeah, thank you so much. This is a new position for me. I am a pharmacist, and I've been a pharmacy manager in Maine, actually, for 8 years. I just took on this new role as Division Pharmacy Manager for New Hampshire and Vermont. So I've been in this role for 2 months now. I am so excited to partner with you. I want to thank you so much for letting Shaw's come on here, and I can represent them for you.
It's awesome. And Shaw's is located in many places in our region. So,
absolutely.
And the City of Nashua and our Division of Public Health and Community Services, the work that we do is in Nashua and the 12 surrounding towns. So I'm sure that there are Shaw's stores throughout. Yeah. So let's talk about some of the initiatives that are in place right now that encourages more community connections.
Right. So I met your partner at our grand reopening in Nashua in July. So we had a grand reopening for our Nashua store to remodel the store for our associates, for the community. So we were really excited to do that for the community. We have Joel Patterson, he's our store director there. We have Mike Bork and Joshua, he's our pharmacist and our pharmacy manager there in Nashua. So we have about 148 Shaw's in New England with 11 pharmacy stores in New Hampshire that I oversee. So we do have some initiatives going on. We do Drive Up and Go. We like to call that DUG. That's our
DUG.
DUG, D-U-G, Drive Up and Go.
That's a nice acronym.
So that ties into our app, and we can talk about that a little bit later. But so if people download our Shaw's app, they can do their groceries on there. They can clip coupons. They earn rewards. They can order their groceries. But we also have now started RX DUG. So you can bundle your prescriptions as well as your groceries together. Pull into the parking lot, give us a call, we'll bring out your prescription and your groceries. So
that is awesome. That makes things a lot easier for many people.
It does.
Right? And so tell us a little bit more about how does one get enrolled into RX DUG?
Yep, so it's just an app on your phone. It's Shaw's app. It's also called Sincerely Health on there when you look at it. You just download it on a smartphone or a computer. Put in some basic information, your email, phone number, date of birth, stuff like that. When you download our app right now, you get $5 off your first $25 grocery purchase.
Nice.
We have all kinds of rewards. So every dollar you spend, you earn a reward. You can redeem that for money off your groceries, free items. Once a month we do a free item in the grocery store, and also a birthday reward. So you can do all kinds of stuff on that app. Every morning when I'm drinking my coffee, I'm clipping my coupons and putting stuff in my cart. So it's very, very user friendly. The prescription side of it, you just link your prescription profile with us. You can go on there, you can refill your medications, you can schedule an immunization appointment. It'll let you know what's ready to pick up. You can do delivery, you can pay for it. There's so many benefits to the app.
So Seana, August is National Immunization Month,
yes.
And so you just mentioned scheduling immunizations. So let's talk about what type of vaccines Shaw's is actually offering in the community and for who.
Okay, yeah. Well, as a pharmacist, immunizations are near and dear to my heart, so absolutely. Any Shaw's pharmacy can do any CDC recommended vaccine for adults. We have flu vaccine is already in our stores right now. We don't recommend till September 1st for flu, but we do have them ready to go right now. We have shingles vaccine, and we have the new RSV vaccine that I'd like to talk about a little bit. It's a brand new vaccine. It protects against RSV, which is a respiratory disease, or virus, sorry. And it's a brand new vaccine that came out for 60 and over with underlying medical conditions. So it's a one-time vaccine, and RSV can be mild or severe in symptoms, so cold-like symptoms, but could lead to, you know, things like pneumonia and stuff like that. So we're very excited to have the RSV vaccine in all our locations right now.
And that's really important because we did experience an outbreak with RSV.
Yes, we did
that
last year.
Not only, typically it impacts children, babies.
Right.
But last year we saw an RSV outbreak in adults as well. So that is very important that that vaccine has been produced, and that Shaw's will be delivering that vaccine to those who, now are there certain qualifications for receiving the RSV? Is it just age, or is it based on a comorbidity that would put a person at highest risk?
Right, it's a combination, so age and comorbidity. So it's a shared clinical decision between the pharmacist and the patient. If they feel like they need it, then we can go ahead and give it.
All right.
Yeah.
So, and you also mentioned the flu vaccine. So it's always really important for people to make sure that they get their annual flu vaccine. So we're definitely going to be encouraging that.
Yes.
We didn't see as bad of a flu season initially as we thought, and then we started to see cases go up.
Right.
And that was because people because the year prior and during COVID, we didn't see a lot of flu.
That's right.
Because we saw a lot of COVID because of the masking that
Mm-hmm.
lots of folks had problems with, but it actually did help prevent a lot of respiratory
It really
infections.
did, yeah.
It kept down the RSV, it kept down the flu, it kept down other respiratory, the common cold. So we had a much healthier community when people were wearing masks. So
Absolutely.
that's one thing that we want people to consider. Even if we don't have a mask mandate, that folks still should consider wearing a mask if they need to. So we want to make that optional for people, and we don't want people to be mask shamed not to wear it if they need to.
Oh, absolutely.
So we did see a decrease in those type of respiratory viruses, and then after people took their masks off, and people, you know, which we definitely encourage more gathering and socializing because of the impact of isolation on our communities.
Exactly.
But we do want people to also get vaccinated because we know the success of vaccination helps keep those infection rates down.
Absolutely.
So flu vaccine, you will also be offering that.
And we do have the high dose for seniors. So
that's important.
All our stores carry our high dose vaccine. So we do have that. We will be getting the COVID. So it's not a booster, it's a new vaccine for COVID. I think we're calling it COVID booster because we're so used to doing that, but it is
the monovalent,
The monovalent, so it'll cover 41 new strains of COVID. So that we're hoping to have within a month.
Okay, and that's going to be important. I just learned today that there is a new variant. I mean, it's a variant of course, the old variants, but there are starting to see more and more cases of that, not to the extreme of what we've seen in our earlier responses, but enough for it to have now made it to the news, which I wasn't aware of until today. And so we definitely do want to encourage folks to get their flu vaccine. We want them to also get the COVID. If they haven't started their series, we need them to finish their series or get it started and finished. And then we want folks to go ahead and get that annual monovalent vaccine that we're not calling a booster, but just like with our flu vaccine. Exactly. We want people to think of it like they think of the flu. So we get a flu shot every year. We don't say, oh, are you getting your flu booster? We just say, are you getting your flu vaccination this year? And I think that we're going to see the same with COVID, because the virus is here and it doesn't look like it's going anywhere.
It's not going anywhere.
And so what is your recommendation as a pharmacist? Will you recommend that adults get their flu and the COVID vaccine together?
Absolutely.
And then how about, or when do they get the RSV? So now that there's 3. And then there's also the pneumococcal vaccination. Do you carry that as well?
We do, all the time. We have the Prevnar 20, we have all the pneumococcal. So I would say to start getting your RSV now, and then in, September, October, come in and get your COVID and your flu at the same time. It's absolutely safe to get both of them together. Flu and COVID is fine. RSV with the flu is fine. So they're all fine to get together, but 3 at once kind of, you know, it's a little much. So we do have RSV right now, so I would suggest everyone come in, get your RSV, wait a month, 2 months, and come back and get your flu and COVID together.
All right. And so just as you said, that folks can actually go on the app.
They can go on the app.
Can they also call the pharmacy and schedule that appointment? And can they walk in?
Absolutely. All of the above. So you can walk in. We'll be happy to take you. You can shaws.com, sign up that way on the app. Give us a call. We'll be happy to schedule your appointment or just have you come down and come in. So it's a very easy process.
All right. And so we also have to talk about the cost, right? And so how is that covered for individuals? Is this covered by their insurance? What about those who are uninsured?
Right. Yeah, absolutely covered by insurance, especially the flu shot every year. I have never seen a flu shot not covered. We do have discount cards that we can help people that don't have insurance, so that's absolutely something we can do. But yeah, mostly insurance will cover any sort of immunization at the pharmacy now.
Okay, that's great. All right, and so you'll be offering the COVID-19 monovalent vaccine, we won't call it a booster, as well as the other vaccines that are part of the adult series. Now, now when we talk about these vaccines, are any of these vaccines available for youth?
We do have some. It's very limited what we can do from state to state. So, you know, here in New Hampshire, you'd want to check with the pharmacy to make sure what they could do. We absolutely can do flu for under 18. Okay. So, but some of the other vaccines we have to check on.
Right. Yeah. And we would always recommend that they stop by their friendly neighborhood health department.
Yes,
at 18 Mulberry Street at any one of our clinics for the regular childhood vaccinations as well. And we will also carry the adults. I think that what's important is that people have choices. So they can either go to their primary care provider. They don't have to hesitate. So if their appointments are pushed out much later than what we would like to see for coverage, they can go to Shaw's. And they can also come to the health department. Our goal is to just get as many people vaccinated as we can in the most timely manner that we can. So that is great. All right. So now, Seana, when we talked, you talked about some other new things that were happening at Shaw's, especially in the pharmacy department. And you mentioned the DIS or DIS pill bubble packs. Do you want to talk a little bit more about that?
Sure.
And is that new or it's just enhanced?
Yeah, it's not new. We'll just call it bubble packing for the ease of you know, conversation. But so yeah, it's an individualized way for the pharmacist to put in daily medication, so by day. It comes in a nice little bubble pack for the month, and the patient can just pop out each day, put their medication. We'll put all the medication in for each day, and they can just pop it right out. So really helps with medication adherence. You know, some people forget, oh, you know, my vitamin, I'm like, did I take that this morning? You know, so it just helps with remembering, you know, did I take my medication? It's a free service we offer in all our pharmacies. So yeah, it's excellent. We do quite a bit right now. I just don't think the word of mouth is out there yet. So this is great. Yeah.
Well, the word of mouth is out there now.
That's right. That's right. Perfect.
On Public Health Matters, right? Where we care about things that matter to the public. And so do you have to request it, or is it an automatic? So if I have several prescriptions that are being filled, is that something that's done automatically, or do I have to request the
You would have to request. Yeah, we don't automatically do it. But it's just very easy to ask for that at the pharmacy.
So when you're doing your, say if you were using the app and you were putting in for your prescription refill, is there a prompt for that?
Probably not right now. That might be that might be something to work on. But yeah, just go ahead and call Mike or Josh down there, and they'll be happy to do it for you. They do quite a bit right now.
And will this be in all of the stores? And so we have the location on Main Street in Nashua. Is this also an option at all of the Shaw's in our region?
Yeah, all our 11 pharmacies in New Hampshire offer it.
Okay, awesome, great.
It's a great service.
Okay, and then we talked a little bit about some things with medications. And so is there anything specific that we want those that are watching Public Health Matters to know about their medications when it comes down to their pharmacy?
To Shaw's Pharmacy. I think there's a little misconception because we're inside a grocery store that we can't do the same you know, medications or have the same medications as some of the big box chains out there, but we absolutely can. We like to say that we are a small town pharmacy under a big umbrella of Albertsons, Shaw's. So we can absolutely do anything that the other pharmacies can do. And you know, we have a lot of people that get groceries in our store but are not using our pharmacy. So we're trying to bridge that gap there too as well. There's all kinds of benefits shopping the pharmacy and then being, you know, drop your prescription off, do a loop around the store and get some groceries and pick it up on your way out. So we can absolutely provide any service.
Right.
Yeah.
So typically, so this is what happens. You go to your doctor's office and say they're going to prescribe you an antibiotic, and they'll say, give me the address of your local pharmacy. And so should individuals now start giving Shaw's address, or can they just, when they get the script, even if it's written for one of the box pharmacies, can they still bring that script in?
Absolutely, absolutely. They can tell their doctor, they can bring it in. If they have a prescription at another pharmacy, we can call and transfer the prescription over. We do have some transfer offers. I'll be careful with that one because it does vary on what insurance you have. So there is some options there. But yeah, we can transfer, we can call the doctor for you. Yeah.
Oh, so that's good. Again, people have some different options and choices. And then you also have delivery. So let's talk about that.
And we also do delivery. So we do grocery delivery, but I'm very excited. We're starting to add in prescription and grocery delivery together. So we do delivery with prescriptions, we do delivery with grocery, but now we're going to bundle that together. So people can use the app and request delivery. So people that are homebound or have trouble with transportation, they can just go on their app, you know, and have everything loaded for them, and then we can deliver it right to their door.
So this app is going to get a lot of use.
This app, and it's very user friendly. I will say, it's you know, my mom uses it. She's in her 70s, so it's very user friendly.
Right, and so for folks that do have, you know, the phone, they just go on the Play Store and just look for the Shaw's app.
Yes,
just put in just some basic information.
Basic information.
And then from there, you can use, what do you toggle down, or you find the little buttons and then you press whatever you need?
Yeah, it'll pop up like all your grocery. So what else it does, which is really nice, it keeps track of what you normally buy. So it'll kind of pop up, you know, oh, Seana, you like Diet Pepsi, so here it is right here for you. So it kind of keeps track, and it'll give you the coupons that you stuff that you normally buy. So it kind of keeps track of what you're buying and giving you like offers on things that you normally buy. So yeah, it's pictures on there, writing pictures. So it's very, very user friendly. I would suggest that people just get on and play with it and see, you know, what they can do. There's a little pharmacy button at the bottom. You just click that. That'll have you link it to your profile with us. You can even transfer your prescription. So say you don't use Shaw's Pharmacy right now, you can go on the app, hit the pharmacy button, and put in where you use. It'll prompt us to call that pharmacy and transfer your prescriptions over.
All right. So what are some safety features that are in there for the user?
Meaning with their information?
Yes.
Yes. So anything we do is always, you know, HIPAA compliant. Everything runs through our legal team. So yeah, everything is very safe on that end.
So Seana, tell me more about the healthy eating benefits that are associated with the app and Shaw's.
Great question. So we have benefits on the app that connect if you have a smartwatch or even to your phone. If you do some daily exercise, we have rings on there. We have different things that you can close the loop or close the ring, it's called, and you earn points for that. So you earn points for healthy living. Some of your grocery selections will actually earn you more points for a healthy selection. So if you go for a walk every day, that's going to earn you some healthy points.
That is awesome. So that's something new that I was not aware of, and we'll definitely take advantage of that. So we really appreciate that. So thank you, Shaw's.
Yes, absolutely.
Now, one of the things, Seana, that we talked about as well is the fact that NASHUA has had an increase in overdoses with regards to substance use disorder. And we've implemented the distribution of Narcan. Because the use of Narcan can save a life until a person's ready to go into recovery or some other treatment program. if a person has an issue with substance use disorder, Narcan is available to help save a life.
Absolutely.
And we talked about Shaw's is also providing Narcan. So can you just share with our audience a little bit more about the decision to start this initially and, you know, as a part of this very important distribution from Shaw's, and why was this important for your organization?
Right. Well, it's important for us as healthcare providers to make sure that everybody has ease of access to medication. And absolutely, this is life-saving medication. So our pharmacist, with a standing order from a provider, can dispense Narcan at any time. So you don't need a prescription. You can just walk up to the counter. You don't have to be a patient of ours. We can easily add that all in, and we can dispense Narcan. It doesn't have to be to the person that needs it. It could be somebody that's concerned about somebody else, a caregiver. Anybody can do it. There's no questions asked. We put your information in and we give you over the counter. So yeah, so we can do that. We can also do bulk orders for employees. So an employer. So if an employer wanted to keep some on hand at their place of work, we can do bulk orders as well for that. So it's a very easy thing to do. Just walk into the pharmacy and ask, and we can do that for you.
All right, and then if there's no prescription that's needed, again, I'm going to ask about costs.
Yep.
Because that can also be a barrier for some.
Yes.
We try as best as we can to have Narcan available all throughout our community, but you know, people may, you know, be in Shaw's getting everything else, and if this is an opportunity for them to have it on hand.
Right.
We've had different incidences where folks have just come across an individual that may have overdosed, and when you have Narcan on hand, you have the opportunity to save a life. So what's the cost? Is it free? Does it get billed to insurance? How do we help get Narcan into as many hands as we can?
Right, right. So it's a varying price there. It is covered by insurances. Most insurances cover at zero copay, most. I have seen some come back with copays, so it really varies person to person. Again, we have those discount cards for people that are uninsured, you know, and we'll always work to get the lowest price for people. So we have multiple discount cards that we can look at, but we will make sure that the person can get it.
Right.
So,
and what about for the businesses as well? How will that, how does a business have access to it? Is it the same way? Or does it go through their benefits department or something like that?
It's the same way. We wouldn't necessarily bill an insurance for an employee or an employer, but we could do a discounted price for them, a bulk order for them.
All right. That's very important. And that also helps support what we're doing in public health.
Absolutely.
Our main goal is to protect, promote, and preserve life and help people to live their best lives and be as healthy as they can. And a lot of these initiatives that Shaw's has put in place for the community does support that. So we're kind of like on the same mission
We
track
are on
there.
the same mission. I did want to add too, when you get an immunization with us, we give you a 10% off grocery coupon. So we work with the front store quite a bit to offer, so you know, healthy eating, healthy living, you know, pharmacy, it all ties into that.
That is awesome.
Yes.
Now tell me, for our audience again, how can people learn more about how to get either their prescriptions, get set up on that app, and you also mentioned that there was an incentive for using this app. So tell us a little bit more about this.
Okay, well the incentive with the app is $5 off your first grocery order of $25 or more. Every time you use the app and you grocery shop, you get rewards. So you earn rewards for every dollar. You can get so much off your next order. You can get free grocery items. They give you a birthday item around your birthday time. So there's all kinds of fun things on the app that you can do with that. So transferring prescriptions, things like that. I would say just come on down and see us. If you can't make it in, just pick the phone up and give us a call. You know, our staff is great, especially in NASHUA. We have Mike, Josh, we have Delane, the technician, and Karen. They're all great people. So just give us a call and say, you know, I saw Seana, your boss, on TV here, and I would like to transfer my prescriptions, and we can absolutely do that. So
that's great.
Whatever way is easiest, you know, we'll accommodate.
Right, and customer service is one way of ensuring that customers will be able to take advantage of all of these new initiatives that you have and the existing ones.
Exactly.
So sometimes it's a little hard.
Yep.
Either signing up for the app or remembering to use some of the benefits on the card. So when you go in with your app, is there anything that you have to do to keep it like updated? Like what are some of those like little tidbits for folks?
So I wouldn't say there's anything for updating.
Good.
When you go in, you put your phone number in.
Right.
So if you've clipped a bunch of coupons on your app, you put your phone number in and it's all connected to the phone number. So that's where the connection is there. I did also want to mention we do pet medications. I forgot to mention that. So our pets are our family too, we like to say. So you know, go get your pet treats and then pick up your pet medications with us too. So we absolutely, a lot of people don't realize that pharmacies can do that, but Shaw's absolutely can do that.
So you can get your food.
You get your food, your dog treats or your cat treats in my case. And
your vaccinations.
Yep, we do it all.
You can get your incentives in there for using the app. You can just like one-stop shopping.
That's right. That's right. Absolutely. It is. It really is. So we like to make it convenient, and I think, you know, grocery store with the pharmacy is very, very convenient.
That is awesome. That's very awesome. So now tell us a little bit about Seana, right? So that's one of the things that we always want to, you know, find out about, you know, our partners. Like, how do you manage and maintain your own self-care? As we are given all of this great information for the community, for consumers, as they come in to shop around in the store, what is it that you all do to help maintain your own self-care?
My own self-care, that's a good question because I just took on this new role. So I am going to be a New Hampshire resident very soon. I am originally from Maine. I've been a pharmacist for 8 years, and I'm 2 months into my new district manager role. So I manage 11 stores in New Hampshire. And yes, self-care, I will say it was lacking a little bit a while ago. So I have tried to get back to some good self-care. So I use the app and I do meal planning. You can do meal planning on the app. Yep. So I'm trying to get better at watching my food and my meal planning with that. So definitely just getting some exercise, putting my laptop down for an hour at night, and, you know, taking a walk and stuff like that. So I'm very excited about this new role and transitioning. I love New Hampshire. It's beautiful. It reminds me of Maine, actually. So it's not too hard of a move for me.
Yeah. Well, thank you for being here with us today on Public Health Matters, and for being a partner with us in the community as we all work together to ensure the health, the safety, the well-being, and nutritional health of our community.
Thank you so much for the opportunity.
We're glad to have you in New Hampshire, and we're glad. I'm sure that Shaw's is glad to have you on board as well.
Thank you. Yes, thank you so much.
So you've been watching the Public Health Matters, and we thank you for taking the time to watch and learn more about Shaw's and the new initiatives that are offered right here in downtown Nashua on Main Street. So stop by the store. Check out, use the app, check out some of those new things, get your appointments in for your vaccines, and let's all work together to ensure the health and well-being of each other by taking care of those things.
Excellent, thank you.
All right, thank you.
Meet the scan, a simple procedure whose mission is to detect lung cancer early.
I'm here to save you!
But I feel fine.
That's great, but you may still be at high risk for lung cancer.
Oh man, that's a new fence.
If you smoke, early detection could save your life. Learn more at savedbythescan.org.